What is allopurinol? Allopurinol is a medicine used to treat gout. Allopurinol is adequate in most patients, but febuxostat, also called Ularic, can be an effective alternative when allopurinol does not work or patient is intolerant to it. Gout is a type of arthritis caused by a buildup of uric acid crystals in the joint. Allopurinol works by reducing the amount of uric acid made by cells. This helps prevent uric acid crystals building up in the joints and therefore helps prevent joints becoming swollen and painful. What are the benefits of allopurinol? Allopurinol is taken on a long-term basis to prevent attacks of gout. This treatment also helps to prevent permanent joint damage. It does not treat acute attack and is not normally started during a sudden attack. It may take several weeks to reduce the level of uric acid. Sometimes starting allopurinol or increasing the dose can actually cause an attack of gout. This does not mean the medicine is not working, so keep taking it during such attacks together with any other medicine your doctor may recommend to manage the pain. To reduce the risk of a gout attack, medicines such as colchicine or anti-inflammatory drugs are recommended at the same time allopurinol is started. What happens if you have a gout attack? Allopurinol is not a pain reliever. You should continue to take allopurinol during an attack. Your pain and inflammation will be treated with medicines like colchicine, non-steroidal anti-inflammatory drugs, or steroids. How is allopurinol taken? Allopurinol is taken by mouth as a tablet. It is usually taken once a day. It should be taken after food to reduce stomach upset. It should be taken with plenty of water. If you forget to take a dose, there is no need to double the dose at the next scheduled dose time. What are the doses? Tablets come in 100 mg or 300 mg strengths. Treatment may start with a small dose, 100 mg or less, and is increased over time to get your uric acid to a level that has been shown to reduce gout attacks. In most studies, the average dose needed to actually lower uric acid is approximately 400 mg each day, although many patients require less. Doses as high as 800 mg per day may rarely be needed. How long is the treatment continued? Treatment should be continued indefinitely as long as it is effective and as long as no serious side effects occur. If you stop treatment suddenly, there is a high risk that your gout may return or worsen. It is very important not to stop your treatment unless advised by your doctor. What are the side effects? Most people do not experience side effects. Tell your doctor if you are concerned about any possible side effects. The most common side effects are nausea or vomiting. Less common side effects include skin problems, tiredness, headache, dizziness, high blood pressure, taste disturbances, and hair loss. Very rarely, severe skin rash and mouth ulceration can occur. When this occurs, it typically happens soon after starting allopurinol and is more common in certain populations. For example, this is more common in Asian and African American populations than individuals of European descent. Yellowing of the skin and or whites of the eyes can be seen if the liver is affected. If any of these changes occur, contact your doctor straight away. How do you monitor allopurinol? You may need to have blood tests during the first few months of treatment depending on what other medicines you are taking and other health concerns. The uric acid level in your blood will be checked to make sure the medicine is working. What happens if you are on other medicines? Allopurinol can interact with other medicines. You should tell your doctor about all the medicines you are taking, including over-the-counter and natural supplements. Allopurinol increases the blood level of the immune-suppressing medications like azathioprine and mercaptopurine. Taking allopurinol with either of these medications can be very dangerous. Other medicines that may interfere with allopurinol include warfarin, ampicillin, amoxicillin, thiazide diuretics, and sulfenpyrazone. Aspirin can be used safely in the low doses. Allopurinol can be taken safely with anti-inflammatory drugs. Can you drink alcohol while taking this drug? Alcohol can trigger an attack of gout. Keep your alcohol intake to 1 to 2 drinks once or twice a week. Drinking more than 4 standard drinks is strongly discouraged. In some cases, total abstinence is recommended. How to store allopurinol? Store allopurinol in a cool, dry place away from direct heat and light. Keep all medicines out of reach of children.